Here's a discussion and case example on horizontal meniscus tears. The meniscus are the structures inside of our knee that are C in shape, and together with the articular cartilage make up the major organs and coverings on the bone. The meniscus itself is a C-shaped structure, similar to a rubber gasket. It has hoop stability due to the posterior root and the anterior root, or attachments where the C shape is attached to the bone. This provides a hoop stability through the roots, which then prevents displacement of the tissue or splaying out when forces are transitioned through the knee. This is the lateral meniscus, this reverse C on the other side of the knee that now is in yellow. And again, it has a anterior and posterior root, or one towards the front and one towards the back, which give it the hoop stability. And if there's a cut through the meniscus or a detachment of the root, then that hoop stability can be broken, and then the meniscus is no longer functional. Together, the meniscus and the cartilage fit together like the pieces of a puzzle. This is an MRI slice where you can see the end of the thigh bone or the femur comes together with the meniscus and then transitions into the leg bone or tibia to make the unit that is the joint of the knee. This joint is an organ just like your heart or your lungs, and the normal transmission of weight across the knee allows for normal balance of proteins within the knee, which we call homeostasis. If there's an injury to your meniscus or loss of your meniscus, the balances are no longer, or the forces are no longer balanced, and you can have breakdown of the knee, which ultimately leads to joint disease and arthritis. When we look inside of normal knees, there's obvious signs of normal appropriate loads across the knee joint. The cartilage is the end of the bones that you can see. The meniscus is to our right, and this allows for normal volume of joint fluid, painless motion, and a balance of these enzymes, as we were alluding to. When there's a meniscus or cartilage breakdown, the knee joint changes and goes through change, and this can be a acute thing or a chronic or slow-acting process. You have abnormal loads, abnormal swelling and fluid, painful motion, and upregulation of enzymes or proteins that can be destructive toward the knee joint. These injuries can be associated with an acute injury event or related to repetitive overloading with certain activities, and also associated with certain body sizes. Horizontal tears are not uncommon in both our population as we age, as well as with athletes, and they're not always painful. They are associated with changes within the knee and the forces that are seen across the knee joint itself. These forces have been studied in cadaver studies, or in knees that have been looked at with making these changes in the meniscus or these injuries to the meniscus. This study looked at this horizontal shape of meniscus tear and looked at the idea of resecting some of that meniscus or all of the meniscus. The tear itself changes the peak pressure seen within the cartilage ends, and then if you repair these meniscuses, you can restore these forces to near normal. Or if you take out some of the meniscus, it is detrimental, and these forces increase in a negative way, which then can lead to increased forces on the cartilage, which then leads to faster wear of the tissues. Here's a case example. This is an 18-year-old football player. He had this horizontal tear that had created a cyst on the side of his knee. Throughout his senior year, he would play with this tear. It would create a cyst throughout the season, most notably on the Saturday after a football game. And we were managing it throughout his season. He was able to play with this tear pattern during the season. His alignment was normal or neutral, and he had this on the MRI. You can see the cyst and how it extends into the knee as a horizontal tear. You can manage these non-operatively by managing the body's response to it or the inflammation. You can also use bracing to unload these areas of injury. But if people have continued symptoms and continued pain despite these initial treatments, that's when we think about repairing these injuries. There's a number of different ways that we can proceed with repair. In this case, we wanted to get some good compression over the cystic area, so we did what's called an inside-out repair, passing sutures from the inside of the knee joint to the outside. We've got this nice crossing pattern, and then also what we call a vertical mattress right here. And we put these mattress sutures not only on the top of the meniscus, but also on the bottom of the meniscus. And so this allows for these sutures to compress the tear and also compress the cyst on the outside of the knee. We also want to improve biology at the site of our repair. And he had the opportunity to see at 1 year his MRI had healed this tear quite nicely, and he had returned to football. So this has been a case example of a horizontal meniscus tear. I hope this was helpful to you if you have this injury, whether treating it without a surgery or with a surgery.